Modifier 54, 55 and 56 are used to report portion of global care. Global care is the care includes global period. So what is a global period? Procedures with global period comprises of three parts: preoperative services, intraoperative services and postoperative care. Preoperative care means care prior to actual surgery or procedure. Intraoperative services are performance of actual surgery or procedure. And post-operative services are care related to follow-up visits during 0, 10 or 90 days after surgery. Concept of global period or global surgical package or global surgery. Global surgical package includes all the necessary services normally furnished before, during and after a procedure by the surgeon or by the members of the same group with the same specialty. That means when the healthcare provider performs a surgery including all usual pre and post-operative care, they may report the procedure using appropriate CPT code for the surgical procedure only. Do not separately bill for visit or services included in global package. This is like when we are vacationing at an all-inclusive resort, our room, food, entertainment, transportation, everything are included in a single price. Similarly, procedures with global surgical package are performed in a single price. To avoid duplication of services, you should know what all are the services included in global surgical package. They are pre-operative visits after the decision is made to operate. For major procedures, pre-operative services includes pre-operative visits the day before the day of surgery, but for minor procedures, pre-operative services includes the visits on the day of surgery only. Intraoperative services that are normally an usual and necessary part of surgical procedure, and all additional medical or surgical services required of the surgeon during the post-op period of the surgery because of complications which do not require additional trips to the operating room. If the complication necessitates the return of patient to the operating room, then that particular services are not included in this package. Then follow-up visit during the post-op period of surgery that are related to recovery from the particular surgery. Then post-surgical pain management by the surgeon. Then supplies except for identified as exclusions. Then miscellaneous services which includes dressing changes, incision care, removal of operative pack, removal of cutaneous sutures and staples, lines, wires, tubes, drains, cast and splints, then insertion, irrigation, removal of urinary catheters, routine peripheral intravenous lines, nasogastric and rectal tubes, and changes and removal of tracheostomy tubes. To build the procedures on global surgical package correctly, you should know what is 0-day, 10-day and 90-day global periods. 0-day global period means no preoperative period and no postoperative period. So, global period applies only for 1 day, that is the day of procedure. 10-day global period means no preoperative period but has 10-day postoperative periods. So, global period package applicable for 11 days including day of surgery. Then 90-day global period begins 1 day before the procedure including the day of procedure plus 90-day follow. That is 90 plus 2, 92 days. This concept can be applicable. The column labeled as pre-op, post-op and intra-op in Medicare physician fee schedule, Medicare will reimburse only that portion of service. As a coder, it is our responsibility to realize payer that which portion of service is performed by the physician, whether it is pre-op, post-op or intra-op. For that purpose, there are three modifiers: modifier 54, 55 and 56. We are putting modifier 56 when physician perform only pre-op care and evaluation of a surgical procedure, and 54 when physician perform only surgical procedure and another physician perform pre and post-op care, and 55 when physician perform only post-operative management of a surgical procedure. We are putting these modifiers along with the CPT code for the particular surgical procedure. Look at the clinical scenario. At the emergency department, a 25-year-old female sustained a dislocation of right elbow with medial epicondyle fracture. Patient was put under general anesthesia and elbow was reduced and was stable. The medial elbow was held in appropriate position and was reduced in acceptable position and elevated to treat non-surgically. A long arm splint was applied, then she is referred to an orthopedist. Here, the patient has two problems. First one is dislocated elbow joint. Second one is medial epicondylar fracture. The emergency department physician reduced both these conditions and then referred to orthopedist. As he is performing all these surgical care, he can put modifier 54 along with CPT 24565 closed treatment of humeral epicondylar fracture medial or lateral with manipulation and 24605 treatment of closed elbow dislocation requiring anesthesia. The orthopedist can report the same CPT with modifier 55 as he is providing post-op care. The correct coding is 24565 54 RT 24605 54 51 RT. Modifier 51 is applied as different procedures are performed on same session, same site. Different procedures are elbow dislocation reduction and epicondylar fracture reduction. Apply modifier 51 to the CPT code for elbow dislocation reduction because it is least paid compared to epicondylar fracture reduction. RT modifier is applied along with both codes to indicate right side. The orthopedist can apply modifier 55 to get paid for post-op care only by agreeing transfer of care. When transfer of care doesn't occur, service of orthopedist may either be paid separately or denied for medical necessity reasons.